Welcome to the Florida Commission on the Status of Women panel discussion on healthcare access and affordability. My name is Dr. Madeline Butler. I am a commissioner and also a practicing OBGYN in the Tampa Bay area. We are at the Women's Group here in Tampa, and we have a group of all-female physicians. Today, I'm very honored to have three excellent panelists that are going to help me lead this discussion today. We have Dr. Kelly Tyce Wells, Dr. Ashley Booth Norris, and Dr. Karen Harris. I will start by introducing Dr. Kelly Tyce Wells. Kelly Tyce Wells is a family physician with a background in public health who serves as Florida Blue's Senior Medical Director for Medical Affairs. In this role, Dr. Tyce Wells oversees the company's health equity strategy and has responsibilities in the areas of corporate social responsibility and public health surveillance. In addition, Dr. Tyce Wells is the clinical lead for Florida Blue's COVID-19 response. Early in her medical training, Dr. Tyce Wells became interested in addressing health disparities and delivering culturally competent care. Dr. Wells taught cultural competency for physicians and incorporated evidence-based techniques to promote health equity into primary care practice in both private and public clinical settings. Before joining Florida Blue in 2018, she spent 17 years as a public health physician, serving in numerous leadership roles, including that of county health officer and state medical director for the Florida Department of Health. Dr. Tyce Wells is a member of the American Academy of Family Physicians, the Florida Academy of Family Physicians, and currently serves as the chair of the Dean's Council, Brooks College of Health at the University of North Florida. She's passionate about healthcare education, and she enjoys mentoring and community involvement. Welcome, Dr. Kelly Tyce Wells. We also have Dr. Ashley Booth Norris. Ashley Booth Norris currently serves as the Associate Chair of Operations for Emergency Medicine, as well as a Medical Director for the Emergency Department, Trauma Center, and Observation Unit for the Department of Emergency Medicine at the University of Florida College of Medicine in Jacksonville. Her background is health policy, both from a legislative and regulatory perspective, as well as in administration. Dr. Norris has various other leadership roles as UF Health Jacksonville, and she currently serves as FMA speaker and on their board of governors. She is president of the Faculty Council for UF Health Jacksonville and serves on the practice plan and hospital board of directors. Thank you for joining us, Ashley Booth Norris. Finally, we have Dr. Karen Harris. Karen was raised in Jacksonville, Florida. She graduated from Vassar College in New York with a BA in biology with honors. She received her medical degree from the University of Florida, and upon completion of her residency in 1989, she returned to Gainesville to begin private practice with North Florida Women Physicians, where she practiced for 29 years. She was the managing partner of the 10 physician group for 13 years. In 2018, she started the new OBGYN residency at North Florida Regional Medical Center. Dr. Harris has been involved in the Florida OBGYN Society. In 1993, she was the first woman president. In 2001, in addition, she was the second woman president of the Alachua County Medical Society, and she's involved in the Florida Medical Association and was on the Perinatal Quality Committee of a national hospital chain. She's active in the American College of Obstetrics and Gynecology and was chair of ACOG District 12 in Florida in 2015, where she sat on the National Executive Board until 2018. She then returned to the University of Florida to further her education in women's health care policy and received her Master's in Public Health in December of 2011. She is currently on the steering committee of the Florida Perinatal Quality Collaborative, and she's a member of the Florida Pregnancy Associated Maternal Mortality Review Committee. So thank you again, panelists. I look forward to a very informative discussion. So the Florida Commission on the Status of Women recently conducted a poll of all Florida women, and we found that healthcare was a top 5 priority concern, with 23% of the respondents that we polled concerned about the issue. In particular, the cost of healthcare and healthcare insurance was the #1 barrier to access reported by women. In fact, this was 68%. So, Dr. Wells, this is a great lead-in for you. What is it going to take to make sure that every person in every community has access to quality and affordable health care?
Thank you, and I'm so delighted to have the chance to participate in this discussion. You know, I can say that across the continuum of my career, one of the things that's been clear is that we have a system that really is designed to do sick care and not a system that is designed to keep people well. And so the failure to appropriately prioritize what it takes to have a system that supports preventive care through the multiple arms that are necessary to do that, through education, through appropriate access to a primary care provider that someone is comfortable with and can get to, through the leveraging of innovative tools, be it telehealth or other digital tools, be it partnerships with community-based organizations. The comprehensive system of care that's been developed is instead focused on the sort of the end of the continuum, and that's where the cost is. And so added to that, the fact that we've got folks who are eligible for coverage and aren't aware that they may have access to subsidy and insurance coverage and don't know how to use it. If the system is tipped toward care at the sort of the tertiary higher cost end of the spectrum, then we will never really accomplish our goal, which is to ensure appropriate access. So I think in terms of solutioning and having done health equity work for such a long period of time, we have to shift the conversation and understand that the system that's been created is doing what it's designed to do. And it's the changes in the fundamental components that are really going to let us affect the appropriate change.
So even if more people are covered by health insurance, it's assumed that access to affordable care will remain a problem. What could community-based resources look like to help with accessing this affordable care for all?
Well, I think very simply that the first step is to ensure that those who aren't covered now gain access. I think that awareness, we find so many folks, upwards of 60% of folks that are eligible for something and simply don't know it. I think also we've learned, one of the things we've learned in the pandemic is the value of a true collaboration. While we have been having conversations for decades about the impact of health-related social needs on health outcomes and the focus that we've all agreed should be placed on the social determinants and all of those things, now in the midst of a pandemic, we find that things became critical. And our ability to then leverage resources in our communities to solve those problems, to co-locate services, to ensure that physicians who were taking care of patients who were at higher risk because of unmet health-related social needs had access to the appropriate resources. We've leveraged digital tools in the last, 11 months that we probably could have leveraged much sooner. But what it has brought about is an integration of a system so that not only do the community-based organizations exist, but now we know about them. We've eliminated the multiple steps that it's taken to access the services, those things that we required a hard copy of and you had to take them to 2 to 3 or 4 locations in order to get certified. Now suddenly, because offices are closed, there is the opportunity then for us to really engage those things in a digital manner. We use a community specialist model where we actually have social workers that are a part of our care teams, and they connect folks to care. Pre-pandemic, they came into a brick and mortar setting, but still used a live person to help them navigate those systems. And so we're learning that the community-based organizations need to, first of all, receive priority funding, but then we also need to be sure that we have a line of sight, we've got an awareness of their existence and how to plug them in. And I don't think those things are well communicated beyond the local community. And as a result, they're not leveraged by all of the other folks in the community, professionals and otherwise, that need the information and need to be able to share it. The other thing I think is a key component is the value of the community health worker and that model, that knowledge of what is going on in the local community and how the health system can be navigated is priceless. And we find that the impact of lower health literacy and patients who just aren't empowered to advocate for themselves and are fearful, of trying to enter the system. Community-based organizations, particularly those who understand how to use and employ a community health worker model, can actually work to be the network, right? And so it takes the hospital system and the payer out of the front and center perspective and lets the care of the community and the health outcomes of the community be community-led, which I think is the best model.
So as a leader in a major healthcare company, what can a company like Florida Blue do to increase access and improve affordability?
Well, I'll tell you, one of the recent commitments that we've made has been to really be much more intentional about our work toward achieving equitable outcomes. And one of the ways we're doing that, certainly financial support over a number of years to address and support evidence-based practices that address health disparities is a big part of that. But the other part of it is for us to, as a payer, adopt what is essentially a health in all policies approach, recognizing that there are some places that we as advocates can step in and use our influence and use our resources to help drive some of the change that we know would improve access. I think that payers are supposed to have a position about, for instance, how the Affordable Care Act could be modified, for instance, to ensure and achieve better access. We're supposed to have an opinion about what should happen with primary care physicians and how we build a model healthcare system that prioritizes that primary and preventive care. We're also supposed to have our eyes on policies and legislation that might influence this, so that again we can use our voice and our resources to influence change. And with the development of our Equity Alliance, I think we've got a number of work streams that allow us to begin to impact that. And it is not just in the care aspect, which I think is key. If you're present in this conversation, and as we do, if we ensure the number of lives we do in the state of Florida, we can't sit silent and allow disparities like what you've described to be perpetuated. And so every place we can be a part of a conversation, every place that we can advocate, every community-based organization or other evidence-based practice that we can support, I think we need to use our voice intentionally to do so. The other thing that we're equipped to do is to leverage innovation. So, begin to apply some of these really innovative models of care that allow access, even in the setting of, not enough providers, not enough diversity in provider networks. We can leverage telehealth and virtual visits and those sorts of things in a manner that actually expands the network significantly. And we've proven that it can be done because of what we had to do mid-pandemic. And so the challenge for all of us is to really be intentional about how we can maintain the gains that we've made as a result of the pandemic.
Well, thank you very much. And we certainly hope that the telehealth innovations that we've had to sort of embrace with COVID continues. That's been a real game changer in trying to provide care during a difficult time. So moving on to you, Dr. Booth. As a consumer, many times they're confused by all the healthcare options that they have. How, as a consumer, would you advise someone to navigate the system to be able to compare prices? And also, can you comment on lower priced products? Are they always the best quality? And are they always the best? Can you comment on that?
So as a consumer, I think it's important. One, to know if you have an insurance product, what your insurance product is and what it covers, because there's going to be different. You've got to be familiar with what your copays are. Copays for if you go to the emergency department, if you're admitted to the hospital, if you're seen outside of the hospital, those can be different. And I think the best thing for a consumer, in a very in something we're talking about health insurance and how complicated it is, even for those of us that are in the healthcare arena, I think it's important to one, know what your insurance product is, know what it covers, know what your copays are, but do know that as a consumer, you can absolutely shop the market. Usually healthcare that occurs outside of the hospital is going to be cheaper. So what I mean by that is if you have healthcare in an urgent care that's not associated with a hospital, or a doctor's office that's not associated with a hospital, if you have x-rays or any sort of imaging done at a freestanding imaging center that's not associated with a hospital, that is usually going to be cheaper than care that is received in the hospital because of cost and fees. And so as a consumer, it is completely within your right to shop and price those things, and see what an urgent care visit's going to cost versus going to your primary care doctor, what an x-ray at the hospital is going to cost versus going to an imaging center. And you'll usually find that they're going to be cheaper outside of the hospital. But to your second point, it's also important to know, is the lowest cost healthcare always the best? If you're looking at surgery centers or imaging centers, urgent cares, I think it's important for you to look online, and as you're shopping for price, also look at what their quality metrics are to make sure that it's a reputable place that has a good reputation, has good quality metrics, as opposed to just going with whatever is the cheapest cost. Clearly, so if you have a relationship with your primary care doctor and you're going to see the doctor outside of the hospital in your primary care's office, usually you have an idea of the quality there. But if you're being sent to a surgery center or an imaging center, you can call, you can price shop, you can also look at what their quality numbers are. That's all public data that's online and available.
Those are very good points. I think stressing the point that you have to be an informed consumer. You have to do your homework and be aware of what options you have available to you. And also know your copays. Many times patients come in and they have no idea what their copay is for the plan that they signed up for. So I think those are very important points. Could you comment on, go ahead.
And I was just going to add, it gets really confusing too as a consumer, because you've got copays and you've got deductibles, which are different, and they're different for different services. And so if you have questions, make sure you ask. You're not going to be frowned upon or looked upon negatively if you ask for an explanation of those benefits. As Dr. Wells was talking about, she could probably speak to that as well. But it's always important to ask up front so that you know what you're getting and what your costs are going to be. Clearly, I work in an emergency department and nobody ever expects to have to see me, but costs in the emergency department are usually, copays in the emergency department are usually higher to keep people from going to the emergency department. So you just have to know that before going into it, and know what your copays and your deductibles and your responsibilities are going to be.
So now that you mentioned that, can you clarify for our audience the difference between a copay and a deductible?
Sure. So typically a deductible is going to be what you have to pay out of pocket before your insurance will kick in. So again, deductibles can be anywhere from a couple $100s to, now we're seeing deductibles that are going up much higher, and people have health insurance products that have what we call high deductible plans. And so we're talking about deductibles that could be $1,000 or $2,000. And that means that's money you have to pay out of pocket first before your health insurance is going to kick in. Usually with the exception that primary care, and Dr. Wells, I think, did a very good job talking about how we have to shift to doing more primary care and preventive medicine up front. So in order to try to push that, a lot of health insurance plans will cover primary care 100%, even if you haven't met your deductible. So if you're going in for a screening mammography, or a wellness check for your a child going in for their wellness check or their vaccinations, a lot of times those things, those preventive care measures will be covered 100%, regardless of whether you've met your deductible or not. But in general, your deductible is what you have to pay out of pocket before your insurance is going to kick in and start paying anything. A copay is what you typically will pay for when you do see your primary care doctor, or you see even a specialist, or if you have prescription benefits. Your portion of what you have to pay to see the doctor or for your medications is typically what's considered your copay. And so even after you've met your deductible, if you go to your primary care doctor, you may have a $5, $10, $20 copay. If you go to the specialist, you may have a $20 or $30, $40 copay. And then you'll have a copay for prescription benefits. And those can go on and be defined for any kind of service that you seek. So hopefully that explains a little bit better the difference between a deductible and a copay.
So you brought up the whole topic of health savings accounts. So how could a health savings account be used to lower your cost? And are there better ways to manage the deductible to help with costs? Could you comment on that?
Okay, I'll take those. I'm going to take those separately. So the health savings account is an account that you can have that money goes into it pre-taxed. And so it's basically money that's set aside without being taxed up to their state and federal limits. But it's money that's put away, that's not taxed, that you can then use towards healthcare. So that is money that if you have the ability and the option to do a health savings account, it's usually beneficial, because what you can do is then use the money that's in your health savings account to help you pay those deductibles and copays. You could also use that money to pay for services that aren't covered by your health insurance company. Examples I can give is if you don't have vision benefits, or if you don't have eyeglass benefits, your health savings account can usually be money that's in that account can be used to pay for those services, dental stuff, vision stuff, eyeglasses, as well as any healthcare cost that's not covered by your health insurance. And so a health savings account is a good way to put money away pre-tax that you have set aside, and that helps you pay for the things that your insurance doesn't cover. What are ways that you can use to manage your deductibles and copays to help you? So one of the things I always recommend for people to do, and this, you can't always do this because obviously we don't always predict when we're going to have a healthcare crisis or emergency, but if you do know that you have to have surgery, or you have to have a big procedure done, it's better to bundle procedures within the same year, because with that deductible that I was talking about earlier, that starts over every year. So depending on your health insurance product, it's usually the calendar year. So January 1st, it starts over. Some products maybe off cycle, but in general, your deductible starts off at the beginning of your insurance calendar, either your calendar year or your insurance year, and you have to pay that out every year. So if this year I had to have surgery, let's say since Dr. Harris is on, I've got to have a hysterectomy. Well, if I know that there's other healthcare things that I need to have done, I need to get new eyeglasses, or I need to have a screening colonoscopy, and I need to have a mammogram, or I need to have another procedure done, it's better to bundle those within a calendar year, because once you've met your deductible, then you don't have to keep paying out. Your insurance company will kick in and pick up more of the costs. And so the cost sharing is going to be higher on your insurance company's side, since you've already met your deductible, as opposed to I have surgery this year, I've got to pay out my deductible, and then I wait and do those other things next year. Well, I may also have to pay out and meet my deductible next year before my insurance company is going to kick in and start paying. So again, if you know that there's multiple procedures or things you need to do, bundling them in a calendar year is a good way to cut down on your costs, and maybe not make you have to pay full out-of-pocket deductible this year and next year. And so those are just some of the little tricks that consumers can use to kind of help with healthcare cost.
That's a very good point, and I think that we have to be smart about how we use our insurance. So on to you, Dr. Harris. So you've heard a lot of talk about health insurance. It's very confusing to patients. How many types of insurances are there? What are the kind of choices that people have that they can make in choosing a plan that's best for them?
Oh, well, thank you, Dr. Butler. Yes, it is very complicated when someone comes in and asks, they're uninsured, but yet they might have options like Dr. Wells was saying, they might qualify for a government plan. That would be great, but you have to usually go through your health department or the Medicaid plan online to figure that out. Right now, it's wonderful that healthcare.gov just opened up. We have that now for 3 months where the uninsured can enroll. And that might be very affordable for them to do that. And in our office, we can't tell that someone's on that kind of plan. It just looks like Blue Cross Blue Shield or Cigna or whatever kind of plan it is. I think there's a little bit of stigma that the people who buy it might say, oh my goodness, my doctor's going to know I went on the healthcare.gov site, but we can't tell. So I think that's pretty cool. And then what about your health insurance through your employer? That is, some health insurance companies, some employers pay for their employee plans, but you do have to sign up for it. But there are set windows. Usually the window is, for about a month that you can sign up for it. However, if you have a qualifying life event, like you have a baby, an adoption, someone gets married, those events, go ahead and sign up. You can qualify for that through your employer. And some employers have it for purchase. They have to take money out of their insurance, out of their salary for that. That might work for them, but they also might want to check on healthcare.gov to see if it's cheaper, particularly right at this particular time. And then what about, there are patients who fall completely through the cracks. They have an employer who doesn't offer insurance. They make too much money to qualify for a government plan. Boy, that's the crack that we have right now. The group of people, 10, 20% of our population fall right there. It's really hard. And
Right.
it's a tough spot. And I wish we had, like Dr. Wells says, a universal solution for them, but we don't have that, especially in Florida.
So, Dr. Harris, can you discuss a little bit about the whole process of applying for Medicaid?
Mm-hmm. Yes, you do need to go through the system. I happen to have some experts in my office because now with the residency program, we see high-risk patients, and half of all women in Florida are on Medicaid, so we do accept a large number of those patients. And you can go through your health department. That's one of the easiest places. Dr. Wells, you were certainly dealing with a lot of that with your patients. If I haven't personally walked people through that path, but you can also go online to apply, but that's a barrier. You're talking about telehealth. It's a great option. I'm in North Central Florida in Gainesville. Sometimes I think we're South Georgia, and there's not connectivity in some of the areas that we serve. I would love we looked at implementing telehealth very broadly, but we struggled. So if you require someone to go online to sign up for Medicaid, sometimes it's hard to do with a cell phone with a cell tower.
Right.
And you just really got to go into the health department office, and they have the computer who can help you sign up.
Okay. So what about Obamacare? Can you discuss what is Obamacare? What kind of options do you have? How do you go about checking that out if you're a curious consumer?
Yeah, that's the Obamacare, the Affordable Care Act, is also at healthcare.gov. Literally healthcare.gov. You go online, and you put in how much you're making, and it sets, how many people are in your household. It's going to look at that, and then if you qualify for discounts. I've had patients who've had only to pay between $50 and $100 a month for great insurance, the Blue Cross Blue Shield plans. And the government picked up the rest of the cost because they were falling in that gap. They made too much for Medicaid. Their employer didn't offer insurance. What a great option for them. It's also for people who are wealthy and well insured, because it's group contracting. together, one plan. So you may have heard that when groups contract together, they get lower rates for their insurance. So that's a really good option just to check it out, I think.
So someone gets sick, they don't have any insurance. What is an option for that person once they're already sick and they find themselves in need?
It's really a tough place. I know Dr. Norris sees these people in her emergency room frequently, and they wander into the health department that, Dr. Wells used to work at. It was hard. You need to try, if you wander into the emergency room will care for you with a severely ill situation. But what if you don't even qualify for that? You need to find a physician who has self-pay pricing, and there are some of us out there who do, who will do that. Your health department can help you find those folks as well. There's also another program called We Care in the state. I don't know if you've ever heard of that, which is through your health department. They screen you. They figure out you don't qualify for Medicaid, you don't have health insurance, but you have a really serious medical problem. And there are physicians who will provide free care in hospitals. So
And I
that's
think
a
that's a very
little bit of a
important
safety net.
That's a very important point to bring up, because I think a lot of patients get diagnosed with cancer and they say, or they know they have cancer and they don't go to the doctor because they don't have coverage.
Yeah.
And there are lots of clinics throughout Florida. Here in Tampa, the Judeo-Christian Clinic will see you for free. You will have free surgery. You will get free medications. If you have cancer, they will take care of you. And I think a lot of people don't realize that there are these resources. Also, the county medical associations, if you find yourself with a very grave illness and you don't have insurance, calling the county medical association can help guide you to some of these places where you can get help for no cost. So I think that that's a very, very important point. So walk me through, if I am, say, a self-employed young woman, healthy, but I say that I am cleaning homes as the way that I make my living. Walk me through what kind of options I may have. And I'm going to turn to you, Dr. Wells. What kind of products would your health insurance company have for someone like that?
Well, I think first of all that I want to acknowledge the fact that this can feel like calculus. It is very difficult to navigate, and step after step with uncertainty can be really hard to kind of push your way through. And knowing that we've got access to resources in the community that can help, and so to add to the points that have already been made, there are multiple products, there are multiple choices, but I think that there's some individual plans that are absolutely affordable, that will allow for some subsidy, so offset of what your monthly costs might be. The key, though, is to not feel isolated as you're making that decision. So my suggestion is to utilize a resource. And you might identify that resource, as Dr. Harris said, in your local health department, but you might also find someone who can help you navigate it, like a Florida Blue community specialist who, again, is there to help not just Florida Blue members, but members of the community at large navigate what we acknowledge is a really difficult thing. During this special enrollment period, there's this opportunity to meet with sales team members for all plans to hear about potential options. But I would imagine that the young woman that you described is relatively healthy, certainly needs to find a plan that appropriately would meet her needs if she's in childbearing age. And needs to think about, what she might need in terms of medication to, manage that part of her life, but also really be certain that she is getting appropriate coverage that's going to allow for all of the well care that's necessary. Somehow that's the thing that folks neglect, and they seem to just remain unaware of, what Dr. Norris mentioned in her opening comments. That's the thing, because we know that improves outcomes. Those are the things that are likely to be available to you at very little copay or cost share. So multiple options out there, plans really that's span the gamut. My suggestion, though, is to find a trusted resource in your community, in your circle, that can help you navigate that. We do a thing at Florida Blue where, we actually have it's called a journey. So we look at a particular part of the insurance coverage journey, and one of those is understanding what I bought, right? So once you've selected your plan, you still have to learn it. And so that's a really important component as well, that the work's not over once you figured something out. Then we want you to learn how to use it as well.
Excellent. Any of the other two of you have anything to add to that?
Yeah, I would add on to what Dr. Wells was saying. For the consumers that are out there, you may have heard about direct primary care, which is one of the new big things that's going on. And under direct primary care, basically what you do is you have a primary care physician. And so if you're young and healthy and you don't have a lot of chronic medical conditions and require a lot of frequent testing and follow-up and medications, some people may find that, oh, it's cheaper if I go and just pay to see my primary care directly, or have a contract with my primary care doctor to do direct primary care. And that is a good option that can be cheaper for people if they're young. Well, they don't even have to be young, but for healthy people that don't have a lot of chronic medical conditions. But I would just caution people to realize that with direct primary care, you don't have any coverage if you had a catastrophic accident, injury, or illness. So if you got in a car accident and were badly injured, or if you suddenly got a diagnosis of cancer, if you don't have health insurance and you're just doing direct primary care, you don't have any coverage when you do get pushed into the hospital setting, or you get sick. And so that's just something that you have to be aware of. You may be hearing a lot about direct primary care now because that is an option that people are going to, but just know that that doesn't provide you comprehensive health insurance coverage, so you just have to be aware of that. But direct primary care is another option that's out there where you can just pay out of pocket, as Dr. Harris mentioned, with those, out of pocket. Some physicians have out of pocket pricing that is cheaper, and so that is an option as well.
Just
So
a thought
Dr.
there.
Norris, go ahead.
I just want to add to that if you choose to do direct primary care, and some of it calls concierge medicine, you pay a monthly fee to be able to see a doctor. Another good thing to combine that with is a very high deductible catastrophic plan.
That's
so
true.
You put those two together. And we do want to remind our women, everyone who's watching, that if you have any health insurance at all with Obamacare, healthcare.gov, any commercial insurance, any Medicaid plans, any health insurance, your annual Well Woman exam is covered with no copay. Please go get that primary care, get your health maintenance done, have your mammograms, your pap smears, please. It's
So I'm glad you
free.
brought
I mean,
up
there's
that
no
point.
copay. Go
Yeah,
do it, please.
Prevention is what leads to good health. So good diet, good exercise, taking care of preventative services, that's really what all of us should be doing. Taking a long walk every day, it's healthy, it's good for your mental health, it's all good. Dr. Norris, I did want to ask you, as an emergency physician, many times patients seek the emergency department when really that's the most expensive place to get care. How do you direct patients in making the decision when to go? I know that's a tough question, but what are some guidelines you can give people on the kinds of things that do require the emergency department and other things that could be handled at the doctor's office or at a walk-in clinic?
That is a tough question, because the bottom line is, once you've arrived in the emergency department, we have to see you and screen you. So and you never want to discourage people from coming to the emergency department if they're sick or they think that they may have a problem. So things that definitely you need to seek care for and not postpone care: if you're having chest pain, shortness of breath, if you're having any kind of stroke-like symptoms, so weakness, inability to talk, facial droop, drooling, anything like that, obviously you should not delay care. You should call 911 and come to the hospital immediately. The things that become a little bit more challenging are, cough and cold symptoms. If you're having a cough, running a fever, abdominal pain, things like that. What we tell people is if you can't say it's not an emergency and you think that there's something wrong, then you should probably come to the emergency department. But if you're not sure, you think, oh, I just need to see a doctor and have something checked out, there's other options out there with telehealth now. If you do have insurance, a lot of the insurance companies now have a number you can call and you can have a telehealth screening. And so you can talk to either a nurse or a physician or a nurse practitioner or a physician's assistant, and they can kind of help you make that decision. They can ask you questions and kind of see what's going on and say, yes, you probably need to go to the emergency department, or no, we can probably wait and see your primary care in the next day or two. So no, if you have insurance, that's an option. If you don't have insurance, then you have the option. Urgent cares are usually a lot cheaper, and they can see those complaints, those everyday cough, cold, runny nose, ear pain, sore throat, things like that. And then if you get to an urgent care and they find that you're sicker than you thought you were, then they would send you on to the emergency department. So that's an option as well.
Excellent. So one last question before we go around and just let each of you just give a very short parting remarks on this topic. So we know that there's a big push toward allied health professionals, advanced nurse practitioners, physician's assistants, those kinds of physician extenders. To what degree do you think that the utilization of physician extenders decrease the cost of healthcare? And I'll start with you, Dr. Harris.
I speak from my world of obstetrics and gynecology, where we work a lot with our midwife colleagues. And if you're having a very normal pregnancy and anticipate that the birth will go well, then midwifery care is far less expensive than an obstetrician. And I would say that much of the data shows the outcomes are improved with lower C-section rates and higher patient satisfaction. So if you qualify for that, for midwifery care, we would encourage women to seek that care. So we work very closely with our midwife colleagues in that regard.
Dr. Norris?
In my setting in the emergency department, again, like Dr. Harris, we have physician's assistants that work directly with us. But in our setting, it doesn't necessarily lower costs because emergency care is emergency care. And then what we do find sometimes with not just your mid-levels or your nurse practitioners and physician's assistants, but also with your younger doctors or your doctors in training, is sometimes that the less experience they have, the more imaging they order. So actually costs can be a little higher, but that's variable and can be person specific. So at least in the emergency department and the urgent cares, it doesn't lower cost specifically. Cost is kind of fixed in my world.
And Dr. Wells?
Yeah, I think those are great perspectives. I think from our perspective, I think there's room for judicious use of that. One of the critical needs in the healthcare community overall is to increase diversity so that we can improve outcomes for patients in communities of color. And I think the access to other professionals might complement that. I think Dr. Harris hit on the thing that's key. It's about relationship. It's about the collaborative relationship between those clinicians and physician providers and the coordination of the work that needs to happen. It has to be a team effort. But I do think there's value in that. I also think there's some innovative models to utilize physicians in training in a way that can help control costs. but also allow access to expertise. For instance, there are models where physicians, not even physicians in training, just physicians who may be in rural practice settings and have less experience with certain things, that can sort of reach out and access a trusted expert colleague, or even reach out to a specialist via a virtual or a telehealth type engagement that allows, again, for that expansion of the network. And I think that can actually improve and support some of the care that could be provided by, advanced practice registered nurses or others. So again, it's innovation that has to drive some of this, because what we're doing isn't working. So, thinking out of the box, using our skill, but also our resources in new ways, will, I think, help us get to solutions that we hadn't quite thought of before, but I think we're in all likelihood right in front of us for a period of time.
Okay, very good. So now just some brief closing remarks before we conclude. We'll start with Dr. Harris.
Well, thank you so much. It's been wonderful to be here with you, Dr. Butler, Dr. Wells, and Dr. Norris. I'm so excited that women would be listening to this program and learning more about our healthcare system. It is challenging. Dr. Norris, you were talking about even copays and deductibles, the difference. It's so hard. All of the different healthcare options. Be sure to, like you said, Dr. Wells, be an informed consumer. It's so important to know what's out there as we navigate our complicated healthcare system. And our wish for all women to have good health care, lots of well woman care, and have a strong, productive life.
Thank you. Dr. Norris.
Thank you, Dr. Butler. I would echo, it's a privilege to be here and talk to all of you. And I would thank you for inviting me. To the consumers and the women that are out there listening to this podcast, I would just again stress, it's been stressed several times, but stress the importance of preventative health. Preventing illness is the best option to save cost. That means exercising, eating right, which we all struggle with, but also not smoking, not engaging in risky behaviors that people don't necessarily think about or talk about either. Making sure you're doing those preventative measures and keeping up. But I would say, and this has been brought to light with the pandemic, if you are sick or you get sick, please make sure that you seek health care. We can help you navigate the system. Reach out to somebody and let us help you. But please, if you're sick, don't delay health care, because what I see in my end of the spectrum, if people delay till it's too late to get treatment for things that could have been treated if it had been caught earlier. So please don't put yourself or your family at risk or jeopardy. And just,
Very
I would
good
say,
points.
stay
Thank
well, and a best to everybody.
Thank you, Dr. Norris. And finally, Dr. Wells.
Yes, this has been a great conversation. I love that it's us talking about us to us. There's great power in that. One of the things that I carried over from my career in public health was, the fear that those who don't have access carry with them about their health. And it runs the gamut from someone who is concerned about something that is, inconsequential and quite minimal, and someone who chooses to ignore something that later presents as a significant issue. When I was working at an FQHC, cancers literally walked through the door, and folks would come having been fearful of accessing care because of the issues with cost. And they would come not because they're finally ready to get treatment, but because they couldn't tolerate the pain anymore. And that is just, that is an indictment of our system. So I would say, a year into the pandemic, where we know, as Dr. Norris mentioned, that folks have avoided care because they're now worried, that is going to translate directly into some diagnoses that we would have made much sooner. And so those of you who are listening, who are out there and who put something off, you don't quite understand it, and you're fearful of incurring some sort of cost that you can't manage, please use the information that's been provided here to move yourself into some phase of action so that you can get your care and your health under control. That's the purpose of this conversation. And so I know that within the sound of our voices is someone who can take an action tomorrow and really change the course of their health as a result.
Thank you so much, ladies. On behalf of the Florida Commission on the Status of Women and on behalf of all of our listeners, I want to thank you for your expertise, your thoughtful time that you have contributed to this discussion. And I wish you all well, and maybe we can get together again on another topic. Thank you very much, and good evening.
Thank you, Dr.
Thank you.
Butler.